Heart failure is a condition in which the heart is unable to pump blood to the rest of the body, leading to symptoms of shortness of breath, fatigue, and volume retention or swelling. And heart failure is caused by a number of different disease processes that all result in that same symptom complex and can be treated by great medications that we've developed over the past 30 years that can improve heart function and decrease the symptoms and prolong lives. Traditionally, we've thought of heart failure as a disease of older people, that over a long period of time with high blood pressure or disease of the coronary arteries, heart attacks, their hearts get weaker. However, this study was interesting because at all age groups, even people below the age of 40, there's increasing risk of heart failure death from that. And so, again, that leads to the question of what is causing increased heart failure in the population and what's causing increased heart failure deaths when we had made so much progress. One of the major things we talk about is lack of access to health care and whether or not people are getting the primary care to reduce those risk factors like high blood pressure, diabetes, treat their obesity, get them exercising. In addition, we know that the number of patients on the medications that are helpful to treat heart failure has decreased over time. So whereas around 2008, approximately 85 to 90% of patients with heart failure were on our top medication. Now it's down to 67%. So people with heart failure are not getting the medications that we know will benefit them. So in younger patients, we're discovering it's more likely that they have genetic causes of heart failure or cardiomyopathy, as we call it, with weak heart muscle, and that they've had a second hit. So they have a genetic predisposition, and then either obesity, diabetes, or toxins like methamphetamine, alcohol, or even good toxins like chemotherapy for a cancer are what put them over the edge.